Well, thank you for inviting me. It was fantastic. Great conversation. You had fantastic questions. Thank you.
Two things of note in the title of your book, Angela. The without medicine part, without medicines part, and we'll discuss that in detail. But the other one is, you call it migraine epidemic. Is it an epidemic, and why?
That's an excellent question. And of all the interviews I've ever had in the past number of years, nobody asked me that question. And I'm so glad that you asked this.
Let's ask the question, is migraine a disease then?
Anybody can have any kind of migraine at any given time.
You do say in the book, I think I'm quoting you here, if I know what causes it, I can stop it.
Right.
So can we stop migraines for good?
Absolutely. For good. Absolutely. Yeah. And similarly, many of the symptoms that you mentioned, that in fact migraine is a lot more than just a headache, which is what everybody think about. In fact, you don't even need to have a headache to have a migraine. And over 20% of the population, of migraine population, don't even have a headache with their migraine. So a headache itself doesn't represent a migraine. The medications are aimed at reducing the headache or make the headache disappear. But that didn't make your migraine disappear.
You cover them in detail in the book. Let's start off with the sodium and potassium, the balance, and why is it so important to migraineurs' brain?
Okay, so this goes back into what I put forth as the cause of migraine, which is that certain regions of the brain, for whatever reason, run low in sodium, in electrolyte. And one of the reasons why this is happening is because the migraine brain is anatomically different from a standard human brain. And this anatomical difference is that the sensory neurons, which are associated with, of course, our sensory organs like the nose, the mouth, the eyes, the ears, and the skin, the touch, the connections, not necessarily to all sensory neurons, I guess each migraineur is different, but for each migraineur, at least one of these sensory neurons are connected differently from people who don't have migraines.
So where would that salt come from? Just the diet?
No.
So we covered some of the vitamins as well. How about other minerals like selenium, zinc, iodine? Are they important?
Yes, actually iodine, I'm glad you mentioned, because we are also supplementing iodine. I'm a protein friendly person. I'm a protein body, okay? And so if you have a full protein of all the amino acids behind it and some fat, you don't need to have carbohydrates. Everybody says you need carb because you need to spike insulin. Well, 80% of the amino acids are glucogenic. They will spike insulin on their own. So you don't need to add any kind of carbohydrates.
But why do you recommend milk? What's in milk? Is it the fat or are there other nutrients in dairy that will help the migrainer's brain?
Okay, so first of all, migraineurs, there's a certain percent of population who are lactose intolerant. And those populations are not present in the migraineurs much. Most of the migraineurs are not lactose intolerant. So we must be coming from the ancestral tribes that were ranchers and farmers who happen to be drinking milk. So for us, milk is a very good thing. Okay, so tea, we don't actually allow in the migraine group. Because tea, any kind, even the herbal teas, they're diuretic. So they dehydrate. And so one of the problems with migraineurs with electrolyte is the proper hydration.
Fascinating stuff. You mentioned we talked about heat and the barometric pressure. How about full moon?
Okay, actually full moon does. And so everybody misunderstands because they think that people go nuts in a full moon. And that's not true. Nobody goes nuts.
Is there a level of insulin resistance in the migrainer's brain, perhaps? Is there a inability to metabolize glucose, for example?
Excellent questions. You must have read my book. Yes.
I read it, all 600 pages of it. These are all my notes.